Hi, my name is Cynthia Summers. I'm a registered nurse attending the graduate program at Aurora University. This dementia literature review is for nursing class 5130, scientific inquiry and research. More than 50% of residents living in nursing homes have dementia or some form of cognitive impairment. By year end of 2011, 23.9% of residents in long-term care facilities were receiving antipsychotic medication. This excludes residents diagnosed with disorders or diseases that warranted medications like schizophrenia, Huntington's disease, or Tourette's. The Centers for Medicare and Medicaid Services, also known as CMS, has partnered with state and federal agencies, nursing homes, other providers, advocacy groups, and caregivers to improve the care of patients with dementia. CMS established a reduction attempt of antipsychotic medication use in residents living in long-term care facilities. The goal was 25% in the year 2015. and an additional 30% by the end of this year. The goal is to provide person-centered care that looks at alternatives to the use of antipsychotic medication to manage behaviors. The picket question used to guide this literature research is in elderly patients with dementia living in nursing homes. The question is, how does the use of technology to modify behaviors associated with dementia as an alternate to psychotropic medications improve their quality of life? The purpose of this presentation is to examine how technology can be used to modify behaviors associated with dementia in elderly patients living in nursing homes to improve their quality of life. A literature review of 5 studies was analyzed. 4 of these studies were quantitative and the other qualitative. The first study examined was written by Tak, Beck, and Hong of 2013, entitled Feasibility of Providing Computer Activities for Nursing Home Residents with Dementia, published in Non-Pharmacological Therapies in Dementia. This qualitative study, level 5 level of evidence, is a descriptive design to examine the benefit of engaging dementia patients living in nursing homes with a 12-week computer activity program as a means of providing a cognitively stimulating, enjoyable activity. This observational study was set in a quiet private room in each nursing home. Each participant was offered the Computer Activity Program, or CAP, for 12 weeks, 5 days per week, and up to 30 minutes per session. 14 participants from 3 nursing homes in a southern state in the United States were selected. All over the age of 65 with a dementia diagnosis and a mini mental exam score between 4 and 27. They had no change in psychoactive medications within the past 30 days of the beginning of this research study. Research assistants used monitoring logs to record time spent, activities engaged, level of engagement, assistance needed, verbal and nonverbal reactions, and barriers. Stopwatches were used to monitor time. Level of engagement was monitored by a 3-point scale developed by Kovic and Magliocco in 1998. 468 observational logs were recorded over the 12 weeks, where participants completed 33 sessions for a total of 936.5 minutes. Participants exhibited positive verbal and nonverbal responses, along with openness and acceptance to the computerized activities. Tech et al. 2013 reports that participants with mild and moderate dementia preferred having a cognitively challenging game such as solitaire, while those with severe dementia enjoyed watching slideshows with music. This study suggests the benefit of initiating computer activities for dementia patients of all cognitive levels. The next study was written by Kalinowski et al., entitled A Randomized Clinical Trial of Theory-Based Activities for the Behavioral Symptoms of Dementia in Nursing Home Residents. This was published in the American Geriatric Society. This quantitative randomized double-blind clinical trial, level 5 level of evidence, was to test the effectiveness of using need-driven dementia compromised behavior model on nursing home patients with behaviors. They hypothesized that activities customized to cognitive and physical, together with personality styles of interest, would improve behavior more than each alone or the active control. Behaviors like agitation, passivity, engagement, affect, and mood were all assessed by video recording and observation at baseline during the intervention, randomized times outside the intervention, and for a week after the intervention. The research was based on 9 community nursing homes involving 129 impaired residents over 4 weeks of activities that occurred twice daily. This is a very generous sample size. The short 4-week study was observed behaviors for 1 week prior to the intervention, 4 weeks during the intervention, and for a week after interventions over a 12-hour period provides a lot of study data. The behaviors were assessed from video recording and observations. Individual scales used to measure behaviors included agitation, that was measured by using Cohen-Mansfield Agitation Inventory, passivity in dementia scale, engagement measured by the use of a stopwatch to calculate an accurate time, engagement observation using a modified version of Nolan, Grant, and Nolan's molar coding scheme, affect using the Philadelphia Geriatric Center Affect Rating Scale, and mood using the Dementia Mood Picture Test. ANOVA was used to compare demographic variables and baseline measurements with chi-square for categorical variables. Mixed model analysis for measurements at intervention, random, and post-intervention phases for the treatment group. All treatments improved outcomes except mood that worsened with the control group. There are many factors that contribute to behavioral symptoms, but the need-driven dementia compromised behavior model derived activities proved to decrease behavioral symptoms in dementia residents living in nursing homes, proving that person-centered care is important and effective. The next study was written by Sung, Chang, and Lee, 2009. It's entitled A Preferred Music Listening Intervention to Reduce Anxiety in Older Adults with Dementia in Nursing Homes. This was published in the Journal of Clinical Nursing. This study is a quantitative quasi-experimental study with a pre- and post-test design, also a level 5 level of evidence. Their phenomena of interest was to evaluate the effectiveness of preferred music listening intervention therapy on anxiety in older adults with dementia living in nursing homes. The participants listened to preferred music preferences twice weekly over a 6-week time frame. Participants included in the study were 65 years of age or older, had a dementia diagnosis, and classified as having moderate to severe cognitive decline with a global deterioration score between 4 and 6. They displayed anxiety symptoms and lived in the nursing home for a minimum of 6 months. Demographic data was collected from patient medical records. Music preference survey was a modification of the assessment of personal music preform, APMP. Anxiety was using the Rating Anxiety and Dementia RAD or RAID and the ANCOVA to determine the effectiveness of the intervention. The experimental group showed a reduction in anxiety when they listened to the preferred music. This is a simple intervention that can be easily integrated into any program. Bordeaux et al. 2015, entitled Feasibility Study of the Bright-Brainer Integrative Cognitive Rehabilitation System for Elderly with Dementia, published in the Disability and Rehabilitation Assistive Technology. This quantitative randomized pilot study, level 5 level of evidence, was to describe and determine the benefit of technology of Bright-Brainer integration into nursing homes. 10 residents living in a skilled nursing facility comprised of 7 women, 3 men, older than 55 and younger than 74, 2 African American, 8 Caucasian, with and without expressed depression ranging in education between 8th grade and college exposure, and whom all spoke English, were exposed to 16 rehabilitation sessions twice per week over an 8-week span in their community. The pre- and post-intervention evaluation session involved data collection of neuropsychological measures of attention, concentration, processing speed, learning, memory, and executive function by a neuropsychologist consultant. The Beck Depression Inventory, Neuropsychological Assessment Battery, Attention Module, Executive Function Module, Hopkins Verbal Learning Test, Brief Visuospatial Memory Test, and Trial Making Tests were used and all compared by paired t-test pre- and post-intervention. Significant improvement was on executive function. Participants expressed improvement in mood and depressive feelings. Further testing needs to determine this pilot study, but the preliminary results suggest it is effective. Moyle et al. 2015, entitled Effect of an Interactive Therapeutic Robotic Animal on Engagement, Mood States, Agitation, and Psychotropic Drug Use in People with Dementia, a cluster randomized control trial, published in BMG. is a quantitative cluster randomized control trial, as the title suggests, was to compare the group with an interactive therapeutic robot and a look-alike plush toy to reduce agitation, improve mood and engagement, as well as improve physical activity and sleep duration as a non-pharmacological treatment alternative on behaviors and psychological symptoms with dementia in people living in long-term care facilities. 35 Australian government-approved long-term care facilities chose 380 residents, 60 years or older, diagnosed with dementia of all types, whom had 22 or less score on the Rowan Universal Dementia Assessment Scale. Only 345 participants were ultimately chosen, with 115 per group in separate facilities, as to not compromise the integrity and expose participants to the other intervention. They participated 3 times per week for 15 minutes, non-facilitated session for 10 weeks, where agitation, mood, engagement, sleep duration, psychotropic medication use, cost, and staff and family perception were measured. CMAISF was used to validate agitation, mood, and engagement measured by video observation using a small GoPro video camera. SenseWare was used to measure sleep duration. Generalized linear models and generalized estimation equations and or multi-level modeling for cluster and individual level analysis status software. This study is currently in data collection. If the PARO proves to be effective, guidelines will be developed for the implementation in long-term care facilities. With CMS initiatives to reduce the use of antipsychotic medication in dementia residents living in long-term care facilities, alternate person-centered care must be closely examined. Technological interventions can be incorporated based upon patient assessment and practicality of intervention. For example, implementing a computer-based activity with only the financial ability to provide one computer is not a feasible intervention for the demand. Methods need to be implemented to evaluate the outcome of the chosen intervention. Alternates to the use of antipsychotic medication on dementia residents living in long-term care facilities are necessary to improve the quality of life. The alternates recommended in this literature review are viable alternatives. Some are more realistic in terms of practicality, like the evaluation of preferred listening music and the scheduling of an activity that incorporates that intervention. While the use of computer programs is a great initiative, it can be costly and does not alleviate the strain on nursing staff, as those with much lower cognitive function will be completely dependent on staff to participate. I have enclosed my references, and I appreciate your time and attention. Thank you.